integrative medicine is essentially, having a crosstalk between the traditional medicine and the usual care that we give, what we call allopathic medicine. Till now, there is a clear divide. One does not see the value of other, but then we think they have a very complementary role. So just to give you an example, in cancer prevention, we know that obesity is a risk factor for cancer and is probably associated with 5 to 8% of all the cancers. But then, there is a lot of inequity in terms of the people having access to services like the exercise, doing exercise, having some physical activities to avoid obesity. In fact, there is evidence to say that men and women with less education, they tend to be overweight, tend to have more obesity. So how do we address this challenge? And we think the traditional and complementary medicine, they have wonderful opportunities like yoga. There are other mind and body exercises that are proved to reduce obesity. There are certain even studies that have shown that they have value in other ways, like improving quality of life of cancer patients also. So how do we integrate these kind of traditional medicine into the routine cancer prevention activities? That is, this is one example of prevention. Similarly, in terms of improving the quality of life of cancer patients, there are it's quite well known that cancer patients, when they are undergoing treatment or even after treatment, they have psychological issues like depression, they have loss of sleep. So all these things have an impact on their care as well as on their final outcome of cancer treatment. And then on the other hand, we have quite good evidence to say that traditional and complementary medicine, there are several things. There is massage therapy, there is yoga, acupuncture, that can take care of many of such problems that cancer patients have. So how do we integrate these two things? That is going to be my focus of the talk today. And essentially what I will argue is that, instead of having this kind of divide, which is there in many countries, even the Ministry of Health is divided across the lines, two lines. There has to be an integration starting from the policy level, starting from the governance level, and then the trust building is very, very important between the two segments of practitioners of the traditional medicine and the routine allopathic medicine. I mean, there has been quite a lot of research in terms of understanding the value of traditional medicine or the approaches in improving cancer care. But then these studies are either very small scale studies, there are methodological issues, and we also understand the fact that you cannot evaluate the traditional medicinal practices the way we evaluate, say, for example, a new anti-cancer drug. There has to be thinking out of the box to see how we can generate the evidence, say, for example, from generating evidence from routine practice. In Europe, it is known that more than 30% of the cancer patients, they also go for traditional medicine. So we have data, we have some evidence there, but then the data has to be collected and then analyzed to understand the impact of these kind of practices, integrative practices on cancer care. So yes, research has to be focused, but then maybe we have to think in a different way. And then there is also importance of doing implementation research in this, because there are many issues here. So for example, when somebody is choosing one type of treatment, they may be neglecting the other type. What is the compliance of the patients when they go for traditional medicine? So does it go down? Or sometimes there is even evidence that if they are appropriately advised and they are really kind of guided to traditional and complementary medicine, they are acceptance of the regular anti-cancer treatment improves. So all these implementation issues need to be also looked at when we are thinking of integrating the traditional and complementary medicine with regular cancer care. If we look at the cancer centers in the US or in many of the European countries, they have already started departments of integrative medicine or alternative medicine within the cancer center. That acceptance of traditional medicine as part and parcel of cancer care has not been there yet in the low and middle income countries. It is essentially because, as I said, that the trust factor is missing. So one sees the other as kind of opponent of their concepts or their thoughts. This bridge has to be, this gap has to be bridged. And obviously there has to be different approaches in different countries. In some countries, like the ministry may take the initiative, but in many countries, the oncologists themselves, they have come together and understanding the value of traditional medicine and then trying to integrate these two approaches. So we are seeing a transition. Obviously, we have, as I said, the oncology centers in high-income countries, they have adopted the policies and then also started the services for access to traditional medicine. But then same thing now we are seeing in India, in China, in Brazil, these countries which are transitioning to, having transition in their economic state. They are also now integrating this. So we are quite hopeful that gradually this will be a routine practice. And now as people understand that this traditional and complementary medicine has the advantages. Number one, it is affordable, it is accessible, and it is highly accepted by the community. So all these benefits need to be translated into the improved cancer care. So, and then the US NCI also has special program to support traditional medicine, especially the integrative medicine. So all these things, I'm sure, will be helpful in improving practice.